Hey everyone, it's Dr. Mike, and today I'm here with Bump, talking about one of the most exciting and maybe nerve-wracking times of pregnancy early labor. So, what exactly is early labor? Basically, it's your body's way of gearing up for the main event, delivery. Now, keep in mind, every pregnancy is unique, but there are some common signs your body might give you as you transition into this stage. Think of it like your body sending out little hints that things are about to get real. Recognizing these signs is super important because it empowers you to prepare for the next steps. Grab your hospital bag and get ready for the arrival of your little one. In this video, we'll discuss some of the telltale signs of early labor so you'll know what to expect and when it's time to reach out to your doctor or midwife. Let's dive in. All right, let's talk about contractions. We've all heard the stories, right? But how can you distinguish between those practice runs known as Braxton Hicks contractions and the real deal? Well, Braxton Hicks contractions tend to be irregular and unpredictable. They might feel like a tightening of your abdomen, but they don't consistently increase in intensity or frequency. Real labor contractions, on the other hand, have a rhythm. They start gradually, build in intensity, peak, and then slowly fade away. This cycle repeats itself, and the contractions get closer together as time goes on. Imagine a wave rolling in, cresting, and then gently receding back into the ocean. That's kind of what a contraction feels like. Now, I know experiencing these sensations can be intense, but try to time them. Keep track of how long they last and how often they occur. This information is incredibly helpful for your healthcare provider, so don't hesitate to call them if you notice a pattern of regular, intensifying contractions. Another common early labor sign is lower back pain and cramping. Think back to those familiar menstrual cramps you might have experienced before. The sensations can be very similar. This pain often radiates from the lower back and wraps around the abdomen. Why does this happen? Well, as your baby descends and prepares to enter the birth canal, they put pressure on your pelvic bones and muscles. This pressure can manifest as a dull, achy feeling or even sharp, intermittent cramps. Every woman experiences pain differently, so what feels like intense pressure to one person might feel like mild discomfort to another. Remember, your body is incredibly strong and capable, but don't hesitate to use tools to manage any discomfort. Taking a warm bath, using a heating pad, or practicing gentle stretches can provide relief. And as always, keep your healthcare provider in the loop about your symptoms. Now, this next sign might sound a little TMI, but it's completely normal and actually a positive sign that your body is preparing for labor. I'm talking about the bloody show or the loss of your mucus plug. Throughout your pregnancy, this thick, jelly-like mucus plug has been acting like a protective barrier, sealing off your cervix to prevent infections. As your cervix begins to soften, thin out, or efface and dilate in preparation for labor, the mucus plug is often discharged. It might come out all at once or gradually in bits and pieces. The consistency can vary too. It might be stringy, sticky, or even thick and gelatinous. And don't be alarmed by the bloody part. The mucus plug is often tinged with blood, which is completely normal. However, if you notice heavy bleeding that's similar to a period, or if you have any concerns, contact your healthcare provider right away. Okay, this is the big one that most people associate with labor water breaking. In movies, it's always this dramatic gush of fluid, but in reality, it can be much more subtle. The amniotic sac, which has been cushioning your baby throughout your pregnancy, can rupture slowly, resulting in a trickle of fluid, or it can break all at once, leading to a more noticeable gush. The fluid is usually clear and odorless, but it might be slightly tinged with pink or green. If you notice a strong odor, it could be a sign of infection, and you should contact your healthcare provider immediately. Also, if the fluid is green or brown, it could mean that your baby has passed meconium, their first bowel movement, in the womb, and you should seek medical attention right away. It's important to note that only a small percentage of women experience their water breaking before labor actually begins. For many, the amniotic sac ruptures during labor itself. As your pregnancy progresses and you approach your due date, you're probably used to feeling your baby move and groove inside your belly. But as your baby drops lower into your pelvis in preparation for birth, you might start to feel increased pressure in that area. It's like your little one is doing a little shimmy down into your pelvis. getting ready to make their grand entrance. This increased pressure can manifest in a few different ways. You might feel a heaviness in your pelvic floor, like your baby is literally resting on your bladder. You might also notice increased pressure on your rectum, making you feel like you constantly need to go number 2. Don't worry, it's all part of the process. And hey, if you haven't already, now's a good time to practice those Kegel exercises. Strengthening your pelvic floor muscles can help you manage this pressure and prepare your body for labor and delivery. So there you have it, some of the most common early labor signs to look out for. Remember, every pregnancy is unique, and you might experience some, all, or even additional signs that we haven't covered here. The most important thing is to listen to your body and trust your instincts. If something doesn't feel right or you're unsure about what you're experiencing, reach out to your doctor or midwife. They're there to guide you through every step of this incredible journey. Don't be afraid to ask questions, express your concerns, and advocate for yourself and your baby. You've got this. And remember, knowledge is power. The more informed you are about the signs of early labor, the more empowered you'll feel as you approach this exciting milestone. Thanks for watching. Don't forget to like this video and subscribe to the Bump channel for more pregnancy and parenting tips.